Now we're going to bring up Jim Hickman, CEO of Better Health East Bay. And this is I talked about activation. This is the confluence of big data, collaboration, technology for better health and better results for especially underserved communities in terms of health. Please join me in welcoming Jim.
Thank you. And so for those who are keeping track of the agenda, this is the middle-aged man with a dream portion of the conversation before we hear from the 17-year-old millionaires. I just want to level set. So I'm Jim Hickman, CEO of Better Health East Bay, and we're part of Sutter Health. Sutter, if you know us, we're one of the largest networks of hospitals, doctors, and caregivers here in Northern California. We take care of 3 million Californians. We take care of Silicon Valley entrepreneurs in this audience and around the neighborhood, as well as some of the most impoverished and needy families in Northern California. And because of that scale and scope, we have a unique opportunity to serve as a laboratory for this country, to take ideas and aspirations, convert them into tests, and try them in the community. Not in an academic setting, not in the garage, but in the real world. And as we think about the importance of that, we think about why healthcare is changing the direction we're going in. So let's talk a little bit about the state of healthcare innovation in America today. Just think, in a 20-mile radius of where we're meeting, there's billions of dollars of private equity and venture funds being invested in new models of healthcare delivery. In this future model, we're going to be accessing healthcare online through digital portals. We'll be sharing data with the cloud, going to our Fitbits and our Apple Watches, all in an effort to help ourselves take better care of ourselves. But this digital health revolution is placing some of our most vulnerable neighbors on the wrong side of a new digital divide. And when it comes to health, that lack of access can be a matter of life and death. So we're going to talk about leveraging technology and information systems to change the way we deliver healthcare with the broadest social impact for some of the most underserved communities in America. I mean, we all know how technology has changed our lifestyles today. Uber, Amazon, Netflix have altered our lives in ways we couldn't think about 3 to 5 years ago. But you know whose life isn't changed by the ability to get a fast ride to the airport or to track when a new pair of Nikes is going to arrive on their doorstep? William. Let me introduce you to William. He's on the screen here. He's 48 years old and lives in Oakland. And William lives in one of those zip codes that just by living there, you automatically deduct 10 years off your life expectancy because of trauma, violence, incarceration, poverty. He has early signs of emphysema, he's asthmatic, and he has high blood pressure. But what's great about William is he raised a family, and now he lives with a 72-year-old mother whom he supports on a minimum wage job. And he uses public transportation to get to work. But when he needs treatment for one of these chronic conditions, he can't take time off from work. So he goes to his local hospital's emergency room. In fact, last year, William came to our ER 17 times for asthma flare-ups so they couldn't take care of at home. Now, around the ERs, they call people like William frequent flyers. They're repeat customers who come to the ER for their chronic or primary care needs because they lack better alternatives. And right now, when he comes into the ER for an asthma attack or sign of high blood pressure, his symptoms are addressed, he's patched up, given some follow-up instructions, and he's sent on his way. That's it. We call it treat and street. It's the reality of an overcrowded and overburdened emergency room. So what are we going to do for William and the scores of patients like him who have this experience? Well, we're making a big bet in Oakland that can have national implications. We want to combine routine healthcare data with a social network platform to create a digital safety net of care providers for William. And then we want to use digital health tools to help William take care of himself. But for us to make this huge change happen, we need to understand a reality about healthcare today. If any of you or a loved one have had to navigate a complex medical issue, you realize pretty quickly that the phrase healthcare system is a bit of an oxymoron. In fact, there is no healthcare system. And just to be clear, I'm not talking about Obamacare or single-payer health coverage or any other program meant to pay for or deliver care. I'm talking about the lack of a hardwired system that knows about you and organizes resources for you in a way that makes it easy for you to take care of yourself or someone you love. But if you think it's hard for you to navigate the health system, imagine what it's like for William and his mom. We do have the technology today to make it easier for William to navigate and stay connected to the healthcare system. And our work will support the use of digital tools to help reorganize this fragmented system into one that is connected and that makes William's life better. So, how do we plan to build this new system of care? First, it starts by simply consolidating the data from William's 17 visits to our emergency department. But it's not just about capturing and collecting data. We've been capturing and collecting and curating and all the C words you can think of for healthcare data for years. We've got buildings still full of paper with data. The uncomfortable question is are we collecting and paying attention to the right data? Are we paying attention to William's life? Are we understanding what's going on at work? What's going on at home, in his community? What happens on the bus? What's going on in the real world? So our plan taps into some special resources of the community. They're called community health workers, and they're in every city in America. They're the unsung heroes who work with people like William and his family every day. They might be stationed at a local barbershop or the community center, but they have their finger on the pulse of the community, their needs and their resources. They're those connectors we talk about. But when one of these folks moves away, the knowledge and relationships they built between the patients and the resources in their own community leave with them. And the patients they looked out for are suddenly disconnected from their support network. With our plan, we will capture that information so that data doesn't leave with them. It stays in the community. So that we'll know that William spends his first paycheck every month on rent, and that by the end of the month he's having a little trouble keeping food in the fridge, and that maybe a call from the local food bank checking in may make a big difference. Or better yet, by sitting across the table from William, we might learn that he's been prescribed a lot of medications, and that he has trouble figuring out which ones to take and when, and that by going to get him a little pill box like this and helping him organize it, he'll do a better job of taking his high blood pressure medication. So when we think about healthcare and what it means, we need to be mindful of William's privacy. But by making William part of the team, we can start to fill in these blanks. No longer is he just an asthma patient or that frequent flyer we see on Fridays. He's a real person, and he needs our help. So third, we can take all the information we've learned from William and do something unique. We'll share it with his other caregivers and the support systems to get the whole picture of William. We need to know who he is. Then we want to add simple tools that give William a personalized network of healthcare and social service providers who are working on the same game plan and who have the means to communicate and collaborate in real time. Our donors are investing in software to connect hospitals, clinics, food banks, paramedics, senior centers, so that regardless of what doorway William walks through, everyone's on the same page. So lastly, I want to talk about hotspotting. I'm sure many of you have heard the term. It was popularized by our partner, MacArthur Genius winner, Dr. Jeffrey Brenner from Camden, New Jersey. He showed us that when you look at where most of our ER traffic is coming from on a map, you discover areas of high concentration, hotspots. And what we find is that what's happening with William is happening to many others in his community. Now, Dr. Brenner set the stage for us. Now we want to supercharge hotspotting with information technology and multiply its impact for the community by doing something very, very simple. Segmenting people by their life and health needs, targeting their issues, and focusing resources on them at the source. So instead of just sitting back in our ER and waiting for people to come in as a last resort, we can use our hotspotting maps to find out where the areas are that we need to focus on the most and go to those areas. For example, we might discover that a bunch of there's a mold in an apartment building because of a spike in asthma-related visits from a bunch of kids who live in the same building. So using our new tools, we can trigger an environmental inspection that provides information not only about mold, but remediation of the problem. So at that point, healthcare goes from being an encounter that we use so often and shifts from a reactive Band-Aid to a proactive alert that something's going on in the community. Here's the multiplier effect. Using hotspotting data this way, we can activate the community resources to tackle social problems that impacts people's health. Now, this is a big deal. We are finally connecting the dots. And in the end, this isn't about data or software. It's about using technology to amplify our basic humanity, to further the human connection from one person to another, getting to know someone, understanding their needs, understanding their life. It's about turning the healthcare system upside down. Now is the time. Thank you very much.